I'll be looking quickly at the pharmacology of another antiviral drug, okay? And this drug is called the Vidarabine, okay? So the pharmacology of Vidarabine and how we'll be doing it. For the pharmacology of Vidarabine, we'll be looking at it at the description, to the mechanism of action, to the indication, to the adverse effects, and the summary of Vidarabine pharmacology. Right. So for the description now, see how this drug looks like. This is basically its mechanism of action. So description now. Vidarabine is an antiviral agent for topical treatment of what? Epithelial keratitis. Okay, so it's available for what? Topical. And once you hear anything is topical, it's for what? Rubbing on the skin and all that. Okay, so it is a synthetic purine nucleoside analog. Okay, so it has some anti-neoplastic properties and has a broad spectrum of activity against DNA viruses in cell cultures and has some significant antiviral activity against infections caused by a variety of viruses. Okay, so what are the mechanism of action of this drug? It has an inhibitory activity of what? Okay, sorry, the inhibitory activity of what? Vidarabine is highly selective due to its what? Affinity for the enzyme thymidine kinase, which is encoded by what? Herpes virus infections and the varicella what? Zoster virus infections. So it is selective towards the thymidine kinase that is in herpes virus and what? Varicella zoster virus. Okay, so that's why it is used to cure infections that are basically inflicted by these viruses. Okay, so this viral enzyme converts what? That's a thymidine kinase now. It converts vidarabine into the vidarabine monophosphate, which is a nucleotide analog. Okay, so now the monophosphate is further converted into the diphosphate by cellular what? Guanylate kinase. Okay, and into the triphosphate by a number of cellular enzymes. Okay, so in vitro, that's on the outside, vidarabine triphosphate stops the DNA replication of what? Herpes virus by being incorporated into the DNA strands and preventing the formation of what? Phosphodiester bridges between the bases. Okay, so now this ultimately leads to what? Destabilization of the viral DNA strands. Okay, so moving indications now, can be used for treatment of chickenpox, that's varicella. It can be used in treating what? Herpes zoster virus infections. It can be used for treating what? Herpes simplex viral infections. Okay, so treatment can also be used for treatment of what? Acute keratoconjunctivitis and recurrent epithelial keratitis due to what? Herpes simplex virus type 1 or type 2. Okay, so adverse effects can cause lacrimation, foreign body sensation, conjunctival injection, burning irritation. I don't really know. This is out of it. Okay, burning irritation, superficial punctate keratitis. It can cause pain. It can cause photophobia. It can cause a punctile occlusion. Can cause what? Sensitivity. All right. So what? Vidarabine. Okay. So moving now, for the summary, we said that vidarabine is an adenosine analog. It inhibits what? Viral DNA polymerase. Okay. Um, it is incorporated into viral and cellular DNA. Okay. It is also metabolized to what? Hypoxanthine arabinoside. All right. And what are the side effects? Can cause a gastrointestinal intolerance and what? Myelosuppression. That's basically its action on the bone marrow, basically reducing all those myeloid, all those stem cells for red blood cells. Okay, so that's it about what the pharmacology of what this drug called vidarabine. All right, so see you guys pretty soon.